Hi, my name is Chris Dukarski. I'm the owner of Ortho Physical Therapy. I want to take this opportunity to welcome you to Ortho, to welcome you to our clinic, and to say thank you for choosing us. As you can see from our website, from our blog, and really by your evaluation recently, that we do things a little bit differently here. The purpose of the evaluation is a couple different things. First off, and primary, to figure out how you're doing, to figure out what's going on in your system. We attempt to identify impairments throughout the system. And we want to kind of figure out how things are connected, because when the foot hits the ground, everything changes. Or when you raise your arm up and your shoulders are bent forward, it can have a completely different effect on that pinch of the rotator cuff. Okay? During the process of the evaluation, we do a lot of different testing. So you might be sore after the evaluation. Sometimes it's a lot of the contacts that we do, the probing to kind of feel what's sensitive, or to identify where scar tissue is, or for even putting your nerve on a stretch to see how sensitive your nerve is. Sometimes your nerves are a little bit more painful, a little bit more irritable after you see us. So cold pack, Aleve, ibuprofen, whatever your doctor recommends for you to calm down pain, Tylenol, for example, take that to calm down your symptoms. Based upon the evaluation, what we do is we establish a plan of care. And the plan of care, there's a couple different things. Our assessment, what we think is going on, okay, a list of problems that we identified from the evaluation, as well as our goals for therapy. Okay, we send this to your doctor. You are more than welcome to get a copy for yourself. This is part of your medical record. And then what we essentially do is a month later we'll follow up with the doctor with a progress note. Okay, but if you have an appointment with your doctor, please let us know, because it could be within 2 weeks of the evaluation. We want to make sure that when you go to see him, we get something in your hand to take directly to him or her, so they know what we've been doing. Okay, so what should you expect from your treatments here? First off, you can go to my website. On our graphic on the home page, it says, how do we treat? I have several different conditions that I've specifically listed out how we go about treating that condition here at Ortho. Things like plantar fasciitis, or knee pain, or shoulder pain, or neck pain, or back pain. That's a place you can start. But when you come here, what you want to expect is to be here about an hour. Okay, make sure you wear something comfortable, loose-fitting clothes, something you can pull up your arm sleeve or your pant sleeve. If you're here for your knee or your lower extremity, bring shorts. You can wear them in. You can change when you get here, because we have to treat sometimes all the way up to the upper part of your thigh. Okay, sneakers as well. No dress shoes. You want to be prepared to exercise when you come to see us. When you initially come in, one of our trainers will bring you in. We'll probably have you start with some sort of warm-up exercise, rolling on the foam roll, using the stick massager, maybe a stretch or two, and then the therapist will work on you. We spend about a good 15 to 20 minutes doing, hands-on manual work to try to break up scar tissue, to increase circulation, to increase the conditioning effect to that tissue, and to try to get you better. Okay. Then essentially you're here for the remainder of the time, going through your self-mobilization, your stretches, your strengthening, maybe some conditioning exercises. We take you through a whole program. You're going to have your therapist and your trainer here working with you hands-on. Your therapist decides what to do. They are the ones that have the right to change your plan of care, to advance your program. Your trainer implements things and supervises things and helps to educate you and instruct you in exercises. So our overall treatment philosophy is almost like a 3-step plan. Okay? Education, alleviation, and prevention. The education part starts the first day. It's extremely important that you listen to what we tell you to do. Okay? And I'm very assertive with my patients. If you don't do this, you will not get better. Okay? So education from day one. We want to get you rolling. We want to show you self-management principles to get you better faster. Okay? The alleviation step is basically us working on you, us directing your plan of care, us showing you how to get from where you are now to being pain-free, being from basically on a crutch back to running again. Okay, the implementation process, what we do hands-on wise, all our specialized techniques that we use here as well. You can go to our website, go to specialized techniques, and see all the different things that we do here. Your plan could include some pump massage, some hands-on, rolling of tissue, followed by some active release technique, followed by some Graston technique, maybe even followed by some cupping afterwards. And then we'll go on to some stretches, some strengthening stuff, some biking, some conditioning. Okay, it all depends on what you're here for. And then the prevention part, of course, is as it implies. We want to prevent you from a reoccurrence of symptoms. So the more we can empower you, the more we can show you, the more we can educate you and alleviate your symptoms, the better it's going to be for prevention in the long run, because you know what to do. And hopefully you'll be consistent with your home exercise program, and things will happen very quickly. So with that said, I'm going to probably follow with another video or two in the span of your time here. Please watch those. We'll give you more education in the process of these videos, and let's get you better faster. Good luck. We'll talk to you soon. Thanks.